Hi, everyone, and welcome to Recovery Science Speaks, a podcast where we explore the people, ideas, and evidence shaping the field of recovery science. This series is going to present an array of conversations with scholars and researchers advancing the science of recovery. Each episode is going to feature a discussion with an emerging or an established recovery scientist to hear their stories, explore their findings, and learn how their work connects to evidence, lived experience, and everyday practice. Designed for the recovery workforce and for scholars new to the field, this series is aiming to make recovery science more accessible and to strengthen that connection between research and real-world application in recovery practice. So I'm your host, Andrea Roche at the Be Well Institute on Substance Use and Related Disorders at the University of Texas at San Antonio. And in my first conversation, we're starting at the source with the principal investigators of a national program, the Peer Recovery Innovation Network, or PRIN. Recovery Science Speaks is actually a product of a national effort led by PRIN to identify priorities for the field of recovery science. And that process involved engagement with an advisory board and a large national survey. And we'll talk a little bit more about that in this episode, but we'll also hear from our guests about their own work and what excites them about where the field is headed. So let's jump in. So hi, everyone. Welcome to Recovery Science Speaks, a podcast series where we explore the people, ideas, and evidence shaping the field of recovery science. I'm your host, Andrea Roche, at the Be Well Institute on Substance Use and Related Disorders here at UT San Antonio. In this first conversation, we're starting right at the source with the principal investigators of a national program, the Peer Recovery Innovation Network, or PRIN. This podcast series is actually the product of a national effort led by PRIN to identify priorities for the field of recovery science, and that process included input from an advisory board as well as a large national survey. We're going to talk a little bit more about that as well as PRIN as a whole, and we'll also hear from our guests about their own work together and what excites them in this field. So we're going to jump in. Dr. Jennifer Potter, could you share a bit about who you are and what you do?
Sure. So I'm Jennifer Potter. I'm a clinical psychologist by training, worked in the field of substance use disorders for a relatively long time, largely starting with the development of behavioral interventions using sort of a classic model of how we develop substance use disorder treatments in the United States, largely funded by the National Institutes of Health, and have been continuing in that field, but much more now working on really not how do we develop new treatments, but how do we actually get things that work out into the community in ways that are contextually based, so that they have the maximum likelihood of success. Because right now, I think access is one of the most important things I'm concerned about.
Wonderful. Dr. Ashford, I'll pop it over to you. A little bit about who you are, what you do.
Sure. And thanks for having me today. I'm a little bit different than Dr. Potter or Jen. I think I can call you Jen. We've known each other for a while, which we're going to talk about. But so my background's a little bit different. I am a researcher, and you're going to hear more about it today, but I consider myself a recovery scientist. But most importantly, I think for my background is I'm a person with lived and living experience. I identify as a person in recovery and have for about the last 16 years. It's how I got into this work, right? The idea from my life was nothing about us without us. And Bill White, historically, when I was an undergrad, before I went on to my master's and PhD, had this call to action in one of his speeches that, advocacy is great and practitioner advocacy is great as peer specialists, but we really need this idea of scientist advocates. And he said, we need recovery scientists. We need people studying our field. And something about that and my cohort as we were in collegiate recovery programs, I think really resonated. So it launched this idea of what my career has become, where I want to study and talk about and evaluate things that happen in the recovery community, my community, about people just like me. And wanting to look at, is what we're doing working? Are we building our own bedrock of evidence, and rather than other people coming in, or at least doing it in collaboration with them so we can inform that work? So today I get to be a recovery scientist. I also get to be a person with that lived and living experience. I run a recovery community organization that I started with my wife in Pennsylvania and Texas, which really serves as the bedrock of what I like to evaluate. I think community-based interventions are phenomenal. I've also done a variety of work related to that around stigma and discrimination in the recovery field, about peer workforce and advocacy and the role that plays in the recovery process. So I'm similar to Jen in that I want to evaluate what we have and how it's working, but my lens is really through, are we including people that it's about actually in the research efforts themselves? And I wouldn't be so bold as to say we started recovery science, but the idea of being a recovery scientist and creating this field is all about that community-based participatory research. And that's where my passions lie.
That's terrific. And that actually leads us into kind of my first question for the day. And I'm not going to assign this one, so it's to either of you or both. But for those who might be new to PRIN, give us a quick overview. What inspired its creation? What is it striving to do?
So I'm happy to kick us off. And the reality is, as my work with Jen over the last decade, I think inspired PRIN. So I didn't come from a background of doing big R01 or National Institutes of Health research. Jen did in her illustrious and long career, and really inspired me to want to do more and go after it. But it was marrying these two kind of concepts. Historically, peer recovery and recovery-related research or recovery science wasn't funded well by the National Institutes of Health, whether at NIAAA, which is the National Institute on Alcoholism and Alcohol Abuse, horrible name, which we talk about stigma, but it's them, or NIDA, which is the National Institute on Drug Abuse, or any of the other institutes. But there was a call that came out a few years ago that was finally about this idea of let's fund the infrastructure for recovery-related research. Is different from clinical or treatment research that has historically been funded. Jen saw the call. We were in the second cohort, and we had been talking about this for years of saying, we need to grow recovery science. We need funding behind it. We need scientists being trained, and we need people in recovery with lived and living experience to be a part of it. And we decided to go for it, right? And being able to leverage her background and expertise, we had done a few studies together and worked together. But we went after it with this combination team as PIs with a great scientific background and passion and advocacy with Jen, and my lived and living experience and background, really evaluating and looking at recovery-related research and recovery science. And we were reviewed favorably, right? And I think we got the actual award on our first PRIN application. We didn't have to resubmit. And it really has spoken to this idea of what I talked about before, creating that community-based participatory process through what PRIN likes to call a collaboratory, which is everybody belongs at the table to do and evaluate peer support and recovery-related research. And I'm grateful to NIH and NIAAA for continuing to fund recovery-related science, because it's still not all that common, right? It was the first kind of efforts in these R24s that have been funded, but we still need more. And I think that's what's so exciting about this work, is we're building that infrastructure to get to more.
And this particular grant is funded by NIDA. So I think that's an important piece of this, is that it was really the beginning of the National Institute on Drug Abuse, recognizing that there's something going on, that there is more than a bivariate outcome of, are you using drugs, yes or no? And, it's interesting, Robert, you answered the question so adequately, but it's funny to listen to you talk about it and think about it from another perspective of the same characters, but another side of it, because part of the reason that PRIN exists is because I met Robert Ashford and heard this whole different view of the world than what I had been historically trained in my, arguably, definitely psychology, but also medical model, where we look at using drugs, not using drugs. But people like me and the work that we did, we go away. We finish, we go. Did you? Didn't you? Great. It worked. You didn't. And that is absolutely imperative. And those questions are really important. And there's this emerging field of recovery, which is kind of funny, because I think that people who work in that field would kind of roll their eyes at me saying that in some ways. But for me, it was a discovery. And so I probably am following the path perhaps of some of the folks at NIDA who were like, wait a minute, what is this thing? But PRIN is the byproduct of two people from very different perspectives looking at a funding opportunity, deeply caring about a problem, but seeing it through slightly different lenses, and saying, again, when I met Robert and heard about what he was doing and what others in the field were doing, I recognized my naivete to it, my curiosity, and I was very, I think, willing to learn. And so I knew some things about writing grants. Robert had beautiful ideas and publication record to back it up. And so we needed to work together to make sure that this PI, Robert Ashford, and the work and philosophy and perspective and the all of that would come together and get funded. So that was, I think, from my perspective, so sort of same, but also kind of different in the way we see it,
And I think it's well stated, because that's what PRIN is, simply stated, right? Is interdisciplinary teams, people from different perspectives coming together in a broader common goal, informed and mutuality around this idea of both the clinical and this emerging idea of recovery viewed through a different lens. But that, I think that's what PRIN is. It's through the external advisory board, the funded pilot projects we've done, the preliminary work over the last couple of years. It's about bringing those people together to bring various perspectives from both lived and living experience, professional experience, to create something new and more innovative and perhaps better explaining the phenomenon we're seeing. But that's PRIN. It's those teams and people with just coming together to do something else.
And to respect the field, and to lend gravitas and respect and the dignity of work to what peers do.
That's great. I think you've both been describing this incredible origin story, and I kind of want to hear, and you've both referenced when you first met or when you first started working. And I think we kind of need to hear a little bit about that and your journey as colleagues collaborating together. So how did you first start working together? A project, or what was that?
So I will tell you that when I was early in my career, I'm going to start this one, Robert. I was early in my career, and I believe in the power of communication, and I really do believe that we have to address stigma. And so anytime anyone would ask me to do anything with the press, I'd be like, yes, I'm there. So somebody said, hey, we're doing this town hall on marijuana legalization, and I went, yes, I'll go. And I show up at this town hall. It was a televised town hall. When this is years ago now. How long? I don't know how long ago. 10 years?
10, 15, almost?
Something like 15. Good Lord. That's very old. And so I show up at this, and the entire audience is a very lovely group of people who love pot. And really believe in access. And this was a long time ago, before there was any legalization. And that's all well and good, but I'm just someone who tries to use data to tell stories. And so I was at this thing that was very clearly one perspective, and I was identified as the anti-marijuana legalization person, or I felt that in my heart. And I looked probably terrified. And there was this young person, that's you, I'm infantilizing you now, Robert, but there was this person who was young, noticeably younger than I was, sitting next to me. And this is my memory of it. He said, I got you. I was like, what have I done?
I didn't have anything at that point either, just to be clear. Like, I may have said that, but talk about gravitas. I had nothing at that point. I was still an undergrad and probably like 90 days into my recovery process. But I also had taken the idea of, I'll just say yes to stuff. They want to fly me out from Dallas to do it? Sure. So that was completely full of it back then. I may still be.
But also think about that moment, because I'm completely thrown. We didn't know anything about each other. I had no idea who he was. He said some group he was with I'd never heard of, which I'm embarrassed to admit now. But at the time, I just knew that this person seemed rational, and I was going to get through this. And I did not need to go on record as being the anti-marijuana person, which was not what I had signed up for. So we navigated it. There were some other individuals, and then we quietly went away. We had a moment, and then I think you reached out to ask me to consult on something when you were in the East Coast somewhere, and we just started hanging out professionally.
Yeah, that event in Town Hall, there was certainly a slant to it. And thinking back 15 years, whether I was young then, I'd just gotten into collegiate recovery, but for me, that was a brand new world. I wasn't a scientist yet, really. You asked me about research, and probably couldn't even describe it, right? My perspective back then was as a young person in recovery is the reason they had brought me kind of in this idea of being on a college campus in collegiate recovery. But what drew me to Jen, and I think one of the reasons I had reached out and we've clicked over the years, was because of what you said, right? You use data to tell stories. It's not slanted one way or the other. It's just, here's what the data says. Let's have an informed conversation. And even back then, that wasn't really a perspective of most people, certainly around, cannabis, medical, or recreational. And it's a lesson that I learned. And I think it's one of the reasons I like our relationship so much, is because it's still how I try to look at the world today, is let's use data to just tell stories. What is the data telling us? And then let's make practical and informed decisions from that. And 15 years later, that's still not a common perspective, right? I think it is in research and science, but that's something, along with, I told the story about Bill White earlier, that really made an impression on young me, is I could do this, right? There's people out there using data to tell stories and help inform our worldview and the things that we do and the decisions we make. And for me, a young in recovery and early in my 20s, that's a message I needed to hear. And fast forward 15 years later, we've gotten to do a lot of cool stuff. But I think every time we see each other, I get to tell people, the idea that people doing recovery science met at a 15 years ago cannabis legalization forum put on by a local news affiliate. Surreal, right? Call it fate, call it what you want, but we were in the right place at the right time, I think, to kick it off and do a lot of cool stuff since then.
The other thing I think about it is that just going back to the Peer Recovery Innovation Network and PRIN, is it demonstrates, even in times when it's hard to have diverse perspectives, because Robert and I don't always agree, and we have to listen to each other a lot. And I think that's where the field is in a lot of ways too. There's a lot of diverse perspectives. That energy of these two distinct but complementary perspectives, and we don't always agree, but we can get to a place of mutual understanding. I also think, Robert, in that moment, I didn't know who you were and you didn't know who I was, and so we just met as people, and that is inherently it builds trust when we just meet as people, and that is the foundation. Again, because had we met in a different way, I might have had my own biases and judgments. What I saw was a complex situation and a really great conversation. And that's, I think, what we could do more of. And I hope that's what these podcasts are about, is starting to expand on this and other things like that. If that made any sense in connectivity there, the connective tissue of PRIN.
It absolutely did. And speaking on sort of pulling on that thread of looking at the data, understanding perspectives that are different, I wonder if you all could talk a little bit more about the national process that resulted in identifying research priorities and the key themes that emerged, and sort of what that means for the shape of the recovery science landscape.
You should take that, Robert.
Yeah, I'll kick us off. So as we set up PRIN, as I mentioned before, a lot of when we were putting the application together was trying to do it with a whole lot of intent, to try to do it in a way that valued this idea of mutuality, of community-based participatory process, the methodology that serves as the kind of underlying grand theory of recovery science or recovery-informed theory. So we did that through this idea of putting together a collaboratory, which I learned about from Jen. I'm still super grateful for reading and getting to deep dive into what that word actually meant, as more than just kind of a buzzword, but this idea that it really resonated with me, because we don't do recovery science in Suto, right? Like the idea that a laboratory can be taken out and be anywhere. It's where people come together to talk, to grow, to learn, and do that in that spirit of mutuality was important. So we set up PRIN that way through an external advisory board. I won't go so far because I don't know every EAB out there on every project, but we were really proud of ours, and I think we should be. There was people that had lived in living experience across the spectrum, from people that had engaged in sex work, people that were actively using drugs in their own, people that identified as in recovery from a variety of pathways, researchers,
big researchers, yeah, I mean, like experts in the field and developing treatments right now and other activities. Yeah.
Yeah, and big projects that are funded and continuing to do great work. We had family members from a perspective of lived and living experience, and we had emerging scientists, right? And people from across this spectrum. The diversity of opinions and experience was, I think, a initial key performance indicator that we had set the bar high for what we could bring in perspectives, both at the AAB level, to help inform this idea of a national process. Because where we started PRIN, our first kind of objective outside of putting this EAB together and setting up the initial framework was, this is an emerging field. Some people, when we say recovery science, are still like, well, that doesn't make any sense. You're just talking about addiction, right? You're talking about addiction science. And we get to talk about that. But when I say nascent, like that may not even describe it. It's so new. So we had to start by looking at what are the research priorities that we're even trying to build infrastructure around. Like, what do we need to know? What do we know? And we wanted to go and talk to people that live and work in this space from those diverse perspectives to identify that, to set this idea of a research agenda that could then be used to inform everything we've done since then. So, methodologically, for our scientists and researchers and those that like this stuff, listening to our first kind of podcast, we did a modified process using Delphi groups, which were popularized in kind of Fortune 500 companies. If you think GE and like Six Sigma Lean, it really came out of this idea of improving corporate processes or manufacturing processes, but it was around building consensus over time. And if you've ever tried to build consensus, it's like sometimes it's a death by 1,000 cuts, right? So we can do that through a process of iterating. The word consensus naturally evolves and builds over time. So we did this along with a method from Dr. Adrienne Lindsay, who's also involved in PRIN and at Be Well at the university, to really intentionally setting priorities and through intentional conversation and through an IPS framework. So we merged those two together, novel methodology. We hadn't seen it ever been done before. And we did this over the course of a few months through various settings, both survey feedback, through live conversation with the AAB, and narrowed down a list of almost, I think, 400 topics that continued to get whittled down, narrowed down as this consensus building process formed. And we got down to setting what the AAB, and reviewed by us, felt like some of the natural emerging research priorities. And then because we're PRIN and we want as much feedback from a variety of stakeholder groups as possible, we went out to the community nationally. So we used MetroQuest, also another novel methodology applied to this type of framework. It's often used in like infrastructure and policy development, appropriations of dollars and kind of government levels. Transportation research, I think it's been used along as well. Jen had found it, but we applied that to go out and get these people's perspectives on these priorities that have been established by the AAB, because we wanted to see, could we find consensus there too? Because oftentimes when you think of research, is that, is it top down? The scientists are coming to tell us what we need, what's important, and where the funding should go. But with our AAB, we protected against that some because we had a variety of perspectives. So this next layer of checking was, where did they agree? Where did this natural national community in a snowball sample responding through MetroQuest, did they align? Did they have consensus? Was there divergence, right? Was there variability? And there was, but there was also a lot of consensus. So those process grouped together as we did the final analysis through the two groups, what emerged was a natural set of initial research priorities. And as I think of that, and there's a variety of them on the PRIN website, you can read them, things around the availability and effectiveness of peer support services in different settings or contexts, best practices and strategies for helping peer staff assist individuals using non-abstinent recovery pathways. I think there's 8 more, right? And again, you can see them on the PRIN website, but one of the more interesting things for me is we found through this, because we got a lot of unique insights, is that the reality is, and it's probably not all that novel if we think of a nascent field, we have a whole lot of ideas, a whole lot of people had priorities, but we still don't know a whole lot. Maybe the farthest we've gotten is we can define some concepts, some interventions, some models. We can define areas of interest of the community, both professional and otherwise, that want to know more. But collectively, I think we verified what should naturally be assumed of a new field is we don't know a whole lot. We can describe them, but we don't actually know if they're effective. We don't actually know for who. We've got limited pockets of kind of a knowledge or epistemology, right? But we need to get a whole lot further. So we took those priorities and were able to craft some examples of what could this look like? What are potential studies? What are the values of those? And we've used those since then to actually go out and fund accelerator projects where emerging recovery scientists both get trained about how to be better scientists, match with experienced researchers and scientists, and propose some initial studies. And those are underway, the first cohort of them right now. So it's not just theoretical, because I think a lot of times, especially as a person in recovery, when we think of policy or agendas, it's like, great, you built another document, but you've done nothing with it. And I think PRIN really gets to lean into who we are, the values that PRIN established when Jen and I proposed it and got it funded, is we actually get to do something with it. We don't do work, we don't collect data to do nothing with. We actually get it to put it into action. And while we still got a whole lot of priorities to do in future years, hint, hint, NIDA, maybe we need some renewed funding, but there's some emerging stuff that's going to come out. So maybe we get just one step further where we do know a little bit more about recovery science, where we do get to push the field forward. And I think that's the goal of all of this.
And just really quickly, just on that, I hope people are listening, but if some of those folks are not scientists and are curious and wonder why it's important to do this work, yes, we don't know everything. And the field of peer services, peer recovery support, the field and recovery itself, all of these services that we invest money in, that the federal government pays for, we could always argue more, but that does invest in local groups, will always be at risk if we don't establish that there is efficacy and what works when, how, and why. And so science should not be the enemy of what these groups do and what individuals do. We should be your partners. To lend humbly what we can to build a robust field, because things wax and waning, and there's something there, right? There's something we believe so strongly is there. The more we can characterize it, codify it, not to take the soul of it away, but to understand it with some parameters, I believe truly that is the best way to continue to build the case to allocate resources to this. Because again, in my field, we know people can quit drugs every day. A lot of people stop using drugs and never talk to people like a treatment program or anything. Why is that? And what can we capitalize? And there's a lot of lessons to be learned for the treatment community as well from understanding recovery science. And so I think that's a really big piece of this as well for people who are skeptical about why you do research like this. What's the point? The programs are already out there and they're working. Well, we need to understand that and tune them and create the potential.
And Jen, you helped me understand a long time ago, because that healthy tension, even, or dissonance in me, exists as both kind of a researcher and scientist early in my career, but also as that person with living experience. But it almost serves as the bridge, right? Because as somebody that's lived it, and I think this often happens for peers and those out there listening, is we know it works, right? Because we're living proof of it. But we need that bridge to more formal kind of Western epistemology and ways of knowing, because that does control money. It does drive policy. And if our goal is that more people, whether they have access or not, have the resources to recover in their own way, and that we're best suited to get them in the right types, or at least suggest the right types of interventions based on their characteristics, the only way to do that, at least in our society, is by having that bridge with scientists to prove that in that way of efficacy. It's also okay to know that it does work for you, that your lived and living experience does matter and should help inform that process. But I had to start viewing science as a bridge rather than the enemy. And I think it's really important for the others out there in recovery. Sometimes we're pitted against more formal systems because they've often harmed us, but they're not the enemy. I mean, scientists like Jen are that bridge and that liaison that we need in our corner, allies we need in our corner every step of the way.
That is terrific. And I think you're both suggesting in a very bright future. And I'd like to kind of end on that note, just in a sentence or less from both of you. What are you most excited about for the future of recovery science? Robert, I'll go to you first.
I don't know if I can say anything in a sentence or less, Andrea, but I will do my best, as I'm already over that allotment. But I think it oscillates and changes for me depending on the day you get me, or where we're at and kind of the zeitgeist at any given time. But what excites me most today, as I get closer to the mid part of my career and no longer necessarily emerging or new, is that the idea of creating the next wave of recovery scientists is what gets me most excited about PRIN today. I do want to know about all the things that helped me in my own recovery. But just like Bill White and Jen did for me earlier on in my career, I'm most excited today for that there's recovery scientists will continue to develop, will continue to carve out their space within this larger kind of scientific field and be respected and get the tools and knowledge they need to push us even further. We're not going to work forever, right? Like we're not going to be in this. And I think the biggest responsibility I have, and it's why it excites me most, is who's coming next, who are the people that get to stand on my shoulders, just like I stood on the shoulders of Jen and people like Bill White. That matters a lot to me today.
I love that.
That was definitely only one sentence.
Yeah, just commas and em dashes all the way through.
I will build on that and say, and that the more we do this work, in addition to the other noble work that we do in the community and with scientists, the more there might be an additional life that is seen and valued and respected and is here to make choices and have agency in their lives as a result of what we do. Because at the end of the day, I think that is a common thing that hopefully unites all of us, is that we want to make an impact on each individual life, one person at a time, one group at a time, so that another life is on this planet.
I love that. No better way to end the start of a terrific podcast series. We're excited to bring you all. Well, thank you both so much for your time. This has been incredibly inspiring and informative for me, and I'm sure our viewers and listeners as well. Thanks for all the work you're doing to advance the field of recovery science. Anyone listening, anyone watching, learn more about PRIN and find links to this episode and future conversations, at the PRIN website. We'll list that information in the description and on the Be Well Texas YouTube channel. I'm Andrea, and this has been Recovery Science Speaks, where we bring recovery science to life, one conversation at a time. Thanks for listening. We'll catch you next time.